Hello, my name is Laurie Dean. I'm doing this video presentation for the Blue Group, which includes myself, Laurie Dean, Lytis Gonzalez, and Sean Irwin. We decided to do our video presentation and essay on the Capstone Case Study O, which is Leading a Hospital Through Crisis. What we'd like to touch on for our video presentation would be the analysis of course concepts, which would be the managerial roles. Those managerial roles in this case study, the CEO follows the 5 functions of management, which include planning, organizing, controlling, directing, and decision making. Another course concept that was analyzed in this case study was mortality rates and quality. The items to consider in this area are the risk factors and other variables that would impact the quality of patient care. And finally, clinical decision making and leadership. An effective and informed leader must look at evidence-based clinical research and decision making, and also best practice as well as clinical outcomes as part of the decision-making process. The case study summary. This case study discusses the secretariat procedure, where a young surgeon is primarily the solo surgeon that's performing this clinical trial procedure. The hospital where the CEO runs the acute care short-term facility was an approved site for this clinical trial for the secretariat procedure to be performed, and one of the senior cardiologists, a trustworthy cardiologist, had brought to the CEO's attention in this case study some concerns about the procedure that this young surgeon was doing. He shared those concerns, and that's primarily what this case study was focused on. So we are going to get into some further discussion on that. So as the CEO, he must respond to these concerns that were brought to his attention by the senior cardiologist and have a plan of action. So the first item in the plan of action was to assess the disease burden, risk factors, and impact on the public health. So some of the things that would be of concern would be complication rates, post-surgery readmission rates, length of stay, and increase in mortality rates that are above the national benchmarks. The second item in the plan of action would be to determine the senior cardiologist, his motive and the validity of those concerns. He is a trustworthy a senior member on the medical staff at the hospital. So really delving into that and doing some fact finding to determine what were his motives for bringing those concerns to the CEO's attention. The third part in the plan of action to address would be to direct a key member to further investigate. That would be the chief nursing officer was who the CEO decided to have address these concerns and do some fact finding, and that would be to really delve into the secretariat procedure, determine what was happening during those procedures, such as if there were concerns that were valid and what those specific concerns were to present those findings, which was addressed in the plan of action number 4. Present the findings to the executive team. That would include the hospital attorney, board members, the chief medical officer, and any other senior executives that really needed to be a part of those conversations with the CEO. Plan of action number 5 would be to consider the professional obligations to those members. So the surgeons, also taking into consideration HIPAA compliance. So as I mentioned on the previous slide, we we're talking about sharing troubling mortality rates above the national benchmark. So this slide really depicts that information. This chart was created by the cardiologist who has no qualifications to be making epidemiological analysis of this procedure. It really does not account for the at-risk population that is being treated. It fails to level the playing field using the risk adjustment, and therefore this chart leads to an inaccurate assumptions about the effectiveness of this procedure. It only looks at the mortality without considering the patient risk profiles, such as the comorbidities and age and other risk factors. The cardiologist is a little bit biased because he expressed concerns about the Secretariat procedure, which inflates the results. Next here we have the data that's analyzed, and that accounts for the patient risk profiles, the unbiased report, the highlights for quality and effectiveness, which mortality rates alone cannot explain. This chart is more accurate, and it depicts, it's a more accurate depiction of the procedure. It shows that there is an issue with the quality and the effectiveness. The information here is more valuable because it shows that the procedure is not the problem, rather the quality of its execution. The issue is not mortality because only one person died from the Secretariat procedure. Here we'd like to discuss the role of the CEO as the leader and the decision maker. In his role, evidence-based data should be used to inform judgment and support the direction. And as the leader, he exhibits different types of power in his leadership style. So expert power, legitimate power, and referent power. As the CEO, in order to be an effective and informed leader, utilizing these different types of power, he has an obligation not only to the healthcare organization, but also to his staff, and to have their best interest at heart, but also to have the best interest at heart of the community and the population, patient population and the public, and working with them, with the people that the organization serves. Balancing that can be rather difficult, and it is a fine line, so that is some of the things to take into consideration for any CEO or top-level executive. Here are the references that we used for our video presentation. We'd like to thank you very much for your time, and we hope that you enjoyed this video. Thank you.